From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. I'm your host, Jonathan Small. So glad that you're back with us today. So upon first glance, my guests, Gina Dubbé and Dr. Leslie Apgar, might not seem to be the likely candidates to own a medical cannabis dispensary. I mean, they're two moms, they live in the suburbs of Maryland, and they have resumes that are loaded with sort of professional certifications. Gina is an award-winning engineer. Dr. Apgar is a board-certified OBGYN. But do not let looks deceive you. These women have opened a dispensary and a cannabis line, and they have been incredibly successful doing so. They doubled their business alone in 2020. Gina Dubbé and Leslie Apgar are the founders of the Greenhouse Wellness Dispensary in Maryland and soon to be in New Jersey, and Blasiva, which is a female-focused cannabis line. And their goal is to break up the stigma that marijuana should remain on the fringes of society, amen, and to help those looking for relief to find solutions to everyday chronic pain and illnesses or symptoms that may constrain them. So welcome, Gina and Leslie, to the podcast.
Thank you for having us.
It's a pleasure to have you. So we love a good origin story. Tell us how you came up with this idea with your background suddenly to switch gears here and open up a dispensary. Tell us a little bit of the origin story of that.
Well, I actually have a medical spa that I opened up in 2008. And it was over there where an offhand comment from one of my patients, hey, would you be interested in bidding as our medical director for a vertical operation here in Maryland, caught my attention. And that I then gave that opportunity to Gina because she was in venture capital at the time and had access to funds and had funds of her own. And I said, hey, Gina, do you want to be a part of this? And that conversation led to a conversation with some folks out in California. And the conversation didn't go as Gina would have expected. So I'll let her take it over from here.
The gentleman was very good at explaining the concept and their view on cannabis. But when I said, what's the projected rate of return? There was a silence and he said, oh, you would never understand that math. Oh. And I'm like, no, I guarantee you, I'll try. I think I can. No, you'll never understand it. So at the end of the call, Leslie and I looked at each other and like typical suburban moms, we were doing this conference call on the way back from playing tennis because we had a 30-minute window and we just looked at each other and said, yeah, this isn't the right one for us. And when I got home, I looked up the RFP on the web and sure enough, we had 10 days left to respond. So I called Leslie and said, let's bid it ourselves. I mean, what have we got to lose?
And you went for it. So tell us how you succeeded in that bid.
So Gina approached this as only an engineer can. She created a matrix with scoring indicators for how much each particular question was going to be worth so that we would spend the most amount of time answering those. And Gina and I came up with an idea to bid this a little bit differently, that we would be really a medical facility run by a doctor and then nurses and then basically residents that we would train ourselves. And it was, I think, a unique model for the commission. And Gina had never, ever touched cannabis. She'd always had a security clearance. So she had to quickly download like 5 or 6 books from Amazon, which is hysterical, on cannabis. What is cannabis? And I basically did the same thing because the endocannabinoid system was not taught to us in medical school. So I had no idea what this was. I just knew that Western medicine was failing my patients. And so I was interested in a new way of providing medication to patients. So the two of us cobbled this together. I promptly left Gina in the lurch. I went on I think a 4 or 5 day honeymoon and left poor Gina there to finish up without me. But I can't say as I'm surprised because Gina tackles problems head on and doesn't easily get waylaid or diverted from her attention. And a year later, on that end, it's a little terrifying because now what do we do?
What was your personal experience with cannabis, each of you. You said, Gina, you didn't have any experience with it, right? You hadn't used it or tried it.
I had none. I
Okay.
had a security clearance from the time I was 18 on because I worked in the Washington Beltway environment. So we were always drug tested. So there was just never a reason or a chance for me to experiment.
And Dr. Apgar, did you experiment?
Yeah, certainly in my teenage years and in college, but being in the healthcare profession, we were drug tested also. So it had really been a long time since I had ever touched cannabis, but I was very receptive to its potential healing benefits. And like I said, I was dismayed by what Western medicine was doing for my patients, which is kind of making them worse. So I was excited about the possibility of getting into a new arena.
So once you got this permit to open the dispensary, how did you approach it to make it different than maybe other dispensaries that you knew about or had been in?
Well, the first thing we did is went and looked at other dispensaries, right, Gina? Go ahead, tell the story, G.
And we wanted our dispensary to be somewhere that was kind and inviting and somewhere our mothers would be comfortable going. We didn't want the stereotype of the dark, seedy dispensary to be alive. So when you come into ours, there are fresh flowers and crystal chandeliers and white leather furniture, and it looks like an upscale med spa. And our clientele is a little different too. I mean, Maryland required a lot of education because it was new, but our clientele is over 60.
Mm.
So our average age is 62, a female demographic. So we cater to a little different than the typical crowd that is thought of in a dispensary.
Yeah. And the other thing that we did, which is different than other dispensaries, is we focus on the education, like right out of the gate, because you have to assume that anybody who's coming to the table has a limited understanding of what cannabis is and what cannabis isn't, because they're probably coming at it from a recreational background where they think it's all about the THC. And certainly that is a problem for us. I mean, we just sort of shrug our shoulders at this point. It's bigger than we are, but patients are always asking us what has the highest THC, and that's not really the way to approach the medication. So we, as a dispensary, really approach every interaction with a patient as a potential learning experience for them. And in some small way, we're able to impart some level of education to everybody that we see. And we're certainly known as the resource in the community and actually nationwide. I field calls and emails from all over looking for education that other dispensaries may not be able to provide.
That's interesting. So what do you tell your patients? What is the question about THC? Is it they're looking for the most THC, or are they concerned that there'll be too much THC and they might have, get too high? Like what's the question they ask about THC?
I wish that it was, I'm worried there's too much THC. It is not as often that conversation.
So these are experienced people.
A lot of them are. And what we have found is that they're actually treating something, whether they're cognizant of it or not. It might be anxiety, especially in these times, PTSD. But certainly I do have the opposite conversation with my older patients because they really need to respect THC. They need to understand what it can do, and you can't undo it when you ingest too much. So we're very focused on the education of dosing and on the route of administration. People come in, they think it's just one thing. They think it's just smoking flower or smoking a joint, but it's so much more than that. And so the conversations are long and varied and hysterical. I mean, me doing a telephone conversation with an 86-year-old who's never vaped before, trying to explain to her how to vape over the phone or by Zoom is the thing of legends. I mean, these are strings of words that I never thought would come out of my mouth. And Gina and I look at each other and just giggle and just like, is this really what we're doing with our lives right now? And I can tell you without any hesitation, it's the most rewarding medicine that we have ever practiced. And to watch the wellness consultants that fill our dispensary also being able to impact people's lives in such a positive way is really gratifying.
What have you learned as a result of this experience about cannabis that you didn't know really or wouldn't necessarily have known before you opened this dispensary and came out with this line?
For me, entering this as a novice, it has been so educational. Our patient number one waited for us to open, and she was in the Afghan war and had a broken back from a Humvee accident, was on a fentanyl pump, and desperately wanted to get off opioids. And within 3 months, she's off opioids. She's able to drive. She's able to function. We've had people with Parkinson's who are now still. I just look at the ability to impact others' lives as amazing. And coming from a non-medical environment, that's a foreign land for me. And people aren't coming in to necessarily get high. We see so much anxiety and sleeplessness with COVID. We see all kinds of different ailments, and a large amount of those are from females and caregivers, for which we believe that cannabis has been missing that element, which is why we started our line Blissiva, which is a combination of the word bliss and sativa. And it's really aimed at the demographic that would like anxiety relief, would like the equivalent of a deep breath or a glass of wine, but they don't want to feel physically impaired. They don't want to smoke in front of their children or their significant others. They want a discreet vaping experience. And so that's what we deliver with our Blissiva Balance line. With our Blissiva Soothe line, it's for premenstrual cramps, it's for menopause, it's for more chronic pain, because we feel like there is a need for diagnosis-based cannabis or specific products for different things. For example, we use the Wanna Choose for anxiety and sleeplessness. And that has helped a host of our patients before bed to have a chew and then go to sleep. It also means that for our elderly patients, we don't worry about risk of fall or psychoactive effects. It merely takes the edge off their anxiety and they can sleep. So it has just changed a variety of things.
And for me, I would say that in medical school, we were taught that cannabis decreases sperm count and it is a gateway drug, and basically stay away from it. And it's absolutely not a gateway drug. It's an exit drug. And it's been very eye-opening about what happens behind the scenes with our government and with big pharma, coming from, being a Western trained, university trained doctor. It's been very eye-opening as to what goes on behind the scenes. But truly, I guess I should have been a naturopath and really understand the way that plants and all of their compounds work together and augment the response. Because certainly what I have noticed practicing cannabis medicine is witnessing the entourage effect, where the whole of the plant is greater than the sum of its parts. And Gina and I completely did a 180 as far as incorporating flower into our menu, into our offerings. We thought, oh, it's dirty, it's tawdry, it's stinky, nobody wants that. No housewife wants to dirty her fingers and do all this flour, this sticky flour. And oh boy, how wrong we were. and how much respect I have for Mother Nature and how much respect I have for the plant that is so healing in its most primitive, basic form. So we've really changed our tune, and I'm encouraged by the science that is starting to happen now, despite our federal government's continued sluggish response to the need for legalization. But the data is coming in from Israel, from Canada, and from some other countries, and it's coming in from the United States as well. There are lots of studies that we are aware of and that we have actually participated in ourselves and will be participating in moving forward. So hopefully we can get some more robust data and we can change the stigma really permanently that still surrounds cannabis.
You two weren't really cannabis users before you got into this business. Have you... Do you use it a little bit now to help with your anxiety or with the things that are going on, sleep, pain, whatever it is that you're dealing with?
I can say I was a novice user. I pretty much only use the Wanna Choose and the Blissiva vape pen, all for anxiety and sleep. And for me, it's sleep, sleep, sleep. But as a side result of using the Choose to sleep, it cured my ulcer. Because it goes through the gastric tract, and that CBD and THC had a really great effect on curing the ulcer. Well, once I cured the ulcer, then you don't have to keep snacking a little bit to keep a little something in your stomach. So I lost 40 pounds.
Oh, wow.
So it's this wonderful set of occurrences that I can attribute directly to cannabis, never having taken it in my 60 years, that it has really helped.
Yeah. And I have started practicing what I preach, which is I prescribe almost universally to any new patient into the program a 10-to-1 CBD to THC capsule that they take every day as a vitamin that they're low on. That's the way I try and explain it to the patients. And so I've been doing that for now over a year, and my inflammatory markers are normal for the first time in my life, and I just feel better. And like Gina had alluded to, it's easier to maintain my weight. It just, I don't have the same cravings. It's just, I'm more balanced. And it's funny because that's what I tell my patients, is that cannabis is in charge of regulating your homeostasis in your body. And if our own endogenous cannabinoids are not doing the job, for whatever myriad of reasons that you can look around our world and guess as to why that might be happening, cannabis is such a wonderful resource to supplement our own low, quote, vitamin levels. So it's been fun for me to practice what I preach. It's been fun for me to be compliant as a physician. Physicians are usually the worst patients ever, but it's been really fun. And I, like Gina, have a placebo by my bed so that if I wake up in the middle of the night or if my brain just won't shut up at the end of the day, I can just have a sip of that. It's just a disposable vaporizer, and I just softly drift off to sleep. It's lovely. I mean, as we get older, most of us tend to have issues with sleeping and sleep disorder. And so it has been a game changer. I mean, we give people our lives back, and it's that sleep of the dead. So if somebody's on a roll where maybe 2 or 3 nights last week, they haven't been able to fall into that deep sleep, if they have one of those edibles by the bed, like Gina was talking about, I mean, they wake up and they're like, my God, I haven't slept like that since I was a teenager. And then it's the lack of that fogginess. There is no hangover like with Benadryl or Unisom or something over the counter, or even the potent sleep agents that so many of my patients are still addicted to. So it's really been fun to take a walk on the wild sides. I mean, it's not anymore. This isn't the wild side anymore. This is so normal. But for Gina and I guess we were a little buttoned up.
Well, yeah. I was the same way before I got interested in the industry. And I'm curious, with your placebo, what is the ratio THC to CBD? You mentioned 10-to-1. Is that kind of what you guys preach, or can you get different?
Yeah, we have different ratios. So the placebo balance pen is a 1-to-1 of THC to CBD, but the potency is not very strong because it turns out you don't need to have these ridiculously high potent pens to get the job done. And that's something that has been difficult for the industry to understand because, again, it's a recreationally focused industry. So taking things down a notch and insisting that, yes, I really do want that much CBD in it. And then it's about adding specific terpenes and specific flavor profiles that would be attractive and discreet for use kind of anywhere in your home or outside the home. So that was the first one that we did for anxiety and for sleep. The second one was Soothe, which has a higher ratio. It's 3-to-1 of THC to CBD, but the potency is stronger. And that is lemon flavored because we want people to be able to work and focus and not feel like they have to take a little lie down in the middle of their morning because the THC is making them very sleepy. So that was mindfully created to keep people awake. We also have formulations for a sex line, which is very interesting because women and men react very differently to cannabis as far as their sex life is concerned. And a little or just right is what will absolutely work, but too much THC makes it not so much of an effect. So it's a little bit of a dance there. And we have some really fun products coming out along that. And then lastly, we have a heal line, which is going to have a few different options, but one that would be affiliated with weight loss or appetite control. And just sort of that 7-to-1, 10-to-1, really high CBD ratios to help heal inflammatory issues.
All right, I can't let that pass that men and women have a different reaction in their sex lives. I want to know can you clarify a little bit what you mean by that?
Everybody wants to talk about this. I don't know why, but yes.
I wonder why.
So as a gynecologist, I have had patients asking me for 20 years plus, my husband wants you to give me a pill that will make me want to have sex with him. And I just start laughing. And, I explain the female sexual response cycle, the male sexual response cycle. It's not the same. You'll never be like that's not the way women work.
As an engineer, men are like a light switch. Women are like a pilot light on a stove. It takes a little while to see the difference.
Right.
That's perfect. That's perfect.
Good analogy.
So it turns out that if you give a little bit of cannabis to women, and it doesn't necessarily matter how you get it in them, and it doesn't necessarily matter what strain, because there's a study out of Stanford that just came out that showed us that. It turns out that women are a lot more receptive and will be absolutely more interested in initiating sex. So the libido goes up. And for women, that's really important because there isn't really anything on the market that addresses that. And then obviously, as anybody who's used cannabis knows, it can intensify the sensations during sex. And it just seems to be more profound in women. And the answer may be because the endocannabinoid system is so densely wired throughout the female reproductive tract. It's more densely wired there than anywhere else in the body except for the brain. So it is a very interesting area of study. I can't wait to see what we find out as more and more research comes in. But clearly there is an association between cannabis and a better sex life.
Fascinating. I have to ask, because you are OBGYN, your views on cannabis and pregnancy. Is there something, what's your take on that?
Yeah, it's so difficult because we know that in the rodent model that high doses of THC cause structural changes in the brain that persist. And we don't know what those structural changes mean in a developing fetus. But as a physician, that scares me. I don't like the idea of structural changes. And the fact that the endocannabinoid system is so primitive and so important, and we're learning involved in so many different parts of a woman's reproductive life, where it is involved in ovulation and in transport of the egg down the tube and an implantation into the uterus, preterm labor, and potentially even labor. It is best not to mess with the natural balance of Mother Nature. And certainly the American College of OBGYN says it's a no-go. Now, I will also say that in the practice of obstetrics, we certainly had patients that were admitted for terrible hyperemesis, where their lives were almost, in jeopardy. And we had to put PICC lines in and give them terrible, terrible medications to save their lives and keep their pregnancies going. And I can only wonder if cannabis in low dose form would have been a safer choice for those types of situations. So I think that to make global statements as far as this go are dangerous. However, this is so much more widely available and now accepted that I think that women and girls think that there is an inherent safety to cannabis, whether it's pre-conception or during a pregnancy. And I think that really have to be cautious about that kind of information so that we really take it seriously and wait for some good, robust studies.
I hope there will be studies soon. And again, that's the importance of making it federally legal so we can do more studies in this country. What's
Hear,
next?
hear.
Hear, hear, right? What is next for your brands and for your dispensaries? I read on your website that you're going to open up in New Jersey.
We are looking at a variety of states. We just won a dispensary in West Virginia. We are looking at some innovative ideas on how to do things. We also would really like to roll Blasiva nationwide, which is a challenge now because you have to process on a state-by-state basis as opposed to being able to move across. So we have a bunch of stuff on the drawing board and we're working hard at it. We're very grateful to be in the industry and have so enjoyed it.
Yeah, and it's wonderful to have people like you in the industry contributing, and to see two women and two professional women. It's what the industry needs. If people want to find out more about your brands, where should they go? You
can always find us at greenhousewellness.com or Blasiva, BLISSIVA.com. Or we have a book on our experience out called High Heels, which is HEALS. And you can find that at highheels.biz.
It's a great name. I love it. You guys are good at names. Placebo is good. High Heels is good.
Thank you.
Good names. Oh, well, this has been fascinating. Gina and Leslie, thank you so much for taking the time to talk to us today.
It's our pleasure.
You.
Enhance Your Life is brought to you by Wana, the #1 infused product in the U.S. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, check out wanawellness.com. That's Wana, W-A-N-A, wellness.com.